Good morning to all of you, dignitaries on the dais, students and guests for the program at IHMR Jaipur. As Dr. S.D. Gupta said, my relationship with this institute goes back a long way. It's a very intangible, at the same time, a tangible relationship. I have a great passion for teaching, and I think this, for me, is like my annual vacation. When I come to IHMR or to Pradanya to teach students, I feel that is the most challenging aspect of anyone who is in a leadership position. I think we should be in a position to inspire and show managers how to execute. I think this, if it is accomplished, you partly fulfill the role of a leader. So I come from the institute called the Kokilaben Hospital. We believe, which means I believe and the team believes, that we have and we are a cradle of talent. Talent is the key buzzword. But talent alone is not enough. You require talent to come up with new transformational ideas, and your organization and your leaders should be in a position to create an ecosystem where these ideas are generated, but more importantly, can be executed. Next slide. So I just took these two keywords and I just have these two quotations which are going to be the anchor. Sustain, imagine. Charles Darwin had said, I have called this principle by which each slight variation, if useful, is preserved by the term of natural selection. Unfortunately, healthcare in our country at this point in time, in many, many domains, is proceeding on the guidelines of natural selection. Let nature take its course, let systems take their course. We have people, we do imagine. And Albert Einstein said the true sign of intelligence is not knowledge, but imagination. So you have imagination, you have evolution, you have natural selection, but for people like me and people like you and anyone who is in a position to take decisions, natural selection is not an option. We are in disruptive times. Your pace of change has accelerated to such an extent that decision makers, leaders, managers have to respond at light speed. Natural selection will kill systems. Natural selection will kill systems which are supposed to deliver excellence. It is an age of intervention. It is an age when you have to intervene with extreme speed, agility as managers and leaders. Then you have a sustainable model. The same Albert Einstein said, and I repeat that, in healthcare, there is nothing which is permanent. That word is almost out of the dictionary. We are in an ocean of change. Either we adapt, or we become extinct, or we become irrelevant. You have choices. Do you want to become irrelevant? Do you want to become extinct? Or do you want to imagine? And do you want to come up with solutions which will address these disruptive changes which are taking place? But there's a catchword. Thomas Edison said, vision or imagination without execution is hallucination. Period. The crux is in execution. Anyone can come up with ideas. We can have oceans of ink which have been spent on writing white papers and proposals and reforms, but where have we faltered consistently? It is execution. We are a highly proficient industry, but we are highly inefficient compared to other industries. The level of efficiency in the aviation industry, The level of efficiency in the financial service industry is light years ahead of us. And we are the sole custodians of nurturing this inefficiency. We do not have a healthcare system in this country, or for that matter anywhere abroad, which is as successful as it should be and as sustainable as it must be. There is this perception that increased spending is going to deliver superior care. Well, we have a system which spends 17.3% of its GDP on healthcare and ranks last in the OECD listing in terms of performance. Why this paradox, even in a mature healthcare system? You have another system in the world which delivers healthcare in a social manner, the National Health Service. Highly inefficient. So what is the problem? There's no shortage of imagination. There's no shortage of ideas over there. Similarly, there is no shortage of vision and ideas here. The single biggest problem is execution. Execution at the ordinary level. You need not execute at the extraordinary level. That is there to be done. We consistently face this problem, and this has to be addressed by leaders and managers. This entire theme of imagining sustainable models will fall flat on its face if it remains at imagination. And unfortunately, that is the problem at this point in time, and you are the people who will be addressing this. And please understand, as Dr. Gupta was saying, we have a public health system and we have a care delivery system. We are talking about sustainable health care systems or health systems. We are talking about health systems. Healthcare is only one vertical of it. Now, if you look at a successful health system, what would you expect in a successful healthcare system? Well, you need healthy people. That is the end point of any intervention which you take, not natural selection. Natural selection is not going to give you healthy people. You will have to intervene at the right place, right time, and you require to get the value of this demographic dividend which he was talking about. Without health, you have no demographic dividend. They will not deliver what you wanted to deliver. So you require a healthy population, whether it is young, whether it is old, and this to a large extent will fall in the domain of what we like to call public health, which is prevention of communicable diseases, managing non-communicable diseases. That is one segment, and the other is the care segment. Besides your healthy people, I think the key is superior care. Our core business, whichever vertical we are in, is superior care. And what does this mean? It essentially means quality of care. Are we effective in the care we deliver? Are we delivering what is safe? Are we delivering care on time? Is care patient-centric? These are big question marks, and whether it is this system or any other system in the world, the single dilemma, the conundrum is affordability as against performance. Performance across healthcare systems is not where it should be. Without that, sustainability is not possible. You also have to look at it in terms of fairness. A health system has to be fair. It cannot deliver care to isolated islands and then you have this ocean of unwell people. You are not going to get where you want as a country or as an organization. So the fairness has to be equitable. There has to be fairness in terms of the patient or the demand side. There has to be fairness in terms of the supplier side. It has to be a system which is fair to both. You cannot have a system which is utopian, which is fair to the demand side and unfair to the supply side. And likewise, you cannot have something which is tilted in favor of the supplier without taking into cognizance particularly the financial condition of the demand side. So there you have this affordability performance equation which is constantly changing. There are no absolutes in it. You are going to have to adapt real time. You will have to think on your running feet. There is no time to stand still. And going at a slow pace is not acceptable. It will not give you sustainable care. Now, besides a successful health system, what is a sustainable system? When do you call a system sustainable? If you understand what that is, then you will probably take interventions which are going to get you to where you want to be. And as Dr. Gupta said, there's that wonderful book which said, what got you here won't get you there. You have this photograph of a man climbing a ladder. He's at the top of the ladder. But there he stops, because he thinks climbing the same ladder is going to get him where he wants to be. It will not. The interventions which were relevant yesterday and which are relevant today may be totally irrelevant for the future. It's not going to deliver what you want in terms of sustainability. So this sustainable system has to be affordable, which we are all aware of. There will be extensive discussions about how to make it affordable, but it cannot stop at the level of a white paper. It cannot stop with single isolated interventions. This will be a multi-pronged attack cutting across all aspects and verticals in healthcare. Then you are going to get where you want. It also has to be acceptable. We come up with ideas, we imagine, we have visions, we are like Nostradamus, we have prophecies, we are soothsayers. But many of these solutions you will find are totally impractical and not acceptable to the demand or supply side. Because someone is crafting these policies or writing down about interventions without getting the buy-in of the stakeholders. And this includes the patients. In evolved healthcare systems, the involvement of the patients, the involvement of the patients with the providers is so well knit. And that is why you have a buy-in from every stakeholder. Typically, at this point in time, we have what you call unifaceted interventions. Someone thinks that this intervention is going to be successful, but not really worried about the ripple effect it will have on other verticals in the healthcare delivery system. And this is why many of these interventions are not getting you where they want to be. I'm just going to give you one example. You had capping of prices on stents and prosthesis. The logical conclusion is that these procedures should become available to a larger segment of the population. It was a wonderful intervention, but not conceived properly, because it was a unifaceted intervention. And because there are other factors involved, this single intervention, we have data now, has not increased the number of angioplasties or joint replacements in the country anywhere, whether metropolitan cities, tier 2 cities, or tier 3 cities. What happened? It just shows you that pricing intervention alone may not necessarily be the answer. It is very nice as a statement to be made which is populist, but it is not going to get you where you want. And this is because the buy-in of all the stakeholders is not there. So you think you have made it affordable, but actually it is not affordable, it is not accessible. Nothing has happened. You had a policy which was put down, and you are exactly what you are, because the solution was not acceptable to all stakeholders. And the final piece about a sustainable healthcare delivery system is adaptability. Change is constant. Nothing is absolute. Even Albert Einstein said, anything and everything is relative depending on the circumstances. The way you deal with that situation will change. There are no absolutes. So you can have some broad frameworks, but managers like you, leaders, have to constantly deal with the challenges which are taking place in the disease profile, in the demographic profile, the onslaught of technology, the onslaught of innovation, the onslaught of scientific discoveries. You cannot insulate the healthcare system from these. And who is going to respond to this change? There is this perception that managers will respond to change. That is a fallacy. There is managers who can manage situations. Organizations have to respond to change. There is a clear distinction between capabilities of individuals to deal with change and the capabilities of organizations to deal with change. Typically in our country, the organizational response to change is almost Darwinian. You have ideas, but the execution arm is weak. You will find individuals who are responding to the change. But that is not enough. Great individuals need not necessarily make great organizations. Organizations also have to be nimble to be sustainable. They have to be fleet-footed to be sustainable. They have to be adaptable. So there is a organizational DNA which has to change. What we are talking about in Imagine and sustainability is your processes, your policies are undergoing mutation at light speed, not at Darwin speed. If you do not change some of the DNA of your organization determining policies, products, processes, you are going to fall by the wayside. There are so many examples. What was considered absolute and sustainable is history today. How many of you have bought Kodak film when you were going on holidays and you had cameras? The film disappeared. Along came digital cameras. They disappeared. What happens now? You have your cell phone, so digital cameras and handy cams have disappeared. Why? What happened? Kodak was a giant company. It had brilliant individuals. The problem is in healthcare also is going to pan out this way. You may not even see the change coming. It is so fast. And that is why as managers and leaders, you have to be so sharp in your vision that you will see these changes early, you will adapt, otherwise you will become extinct. Kodak has filed for bankruptcy. This whole change took place in 9 years. Nokia and Motorola, who are leading cell phone makers in the world, did not see the threat of the smartphone. They felt that this is just a gizmo which is going to be bought by some techno geeks and that is the end. Well, you know where Nokia and Motorola are and where the smartphone industry is. We are subject to the same danger. We have blind spots. We may see change, we may choose not to react. Many a time because we are so fixed in the way we think, we do not see the change. And by the time you respond or you see it, it is too late. You are extinct. So healthcare systems also, sustainability is all about being so adaptable. We have scenarios in healthcare. I will speak from the side of a surgeon. There were people who were not trained in keyhole or laparoscopic appendicectomies and cholecystectomies. They said the old way of doing it, a surgeon likes exposure, a surgeon likes to see what he's doing, and they said this is just, some kind of fancy technique. Today, open surgery for cholecystectomy and appendicectomy is extinct. This has happened in 10 years. If you do not do that, you may be the most experienced and senior surgeon. You will not be able to deliver what the consumer wants. So there are so many of these changes happening. And sustainability is all about the ability to deal with change, and unfortunately we are in an ecosystem right now where change is not incremental. Christensen from Harvard said you have incremental change or sustainable change. You can deal with that because you just pick up something which you're doing and you make it a little better and then you make it a little better. It's incremental. It's very comfortable, that pace of change. That pace of change is acceptable where you have mediocrity. Where you have excellence Incremental innovation is not an option, it has to be disruptive innovation. By definition, disruptive innovation is going to lead to disruptive change in our healthcare systems, and you do not have the option of dealing with it at your own pace. If you do, you will be nowhere. So with this scenario, with the core dilemma of affordability and superior care, it's wonderful how it has been broken up into boxes. Yes, you design sustainable health systems, not necessarily healthcare systems. We are lucky that we have seen the failures of some systems which were adopted by various countries, so we are not the first movers. If you look at the whole managing disruptive change, there are so many examples how to do it. I do not want to get into detail, because each of these sessions will deal with it. You have the role of analytics, mobile. This is something I always believe. I had been to a panel discussion where someone put up a mobile phone. One of my colleagues was a CEO and said, "This is the future of healthcare." What a fallacy. We are going through this because I want to pre-warn people. We believe that technology is the answer to everything. Just like we had the internet bubble, I would recommend caution about this mobile applications, and they are all excellent enablers. They are going to improve your accessibility, but there is this kind of euphoria in the healthcare industry that this is the answer to all my problems, where they have consistently forgotten the part that healthcare is not a commodity. You cannot commoditize healthcare. You can commoditize financial services, you can commoditize travel, you can commoditize airline tickets, you cannot commoditize healthcare. The person-to-person interface is so critical over there, and I would again recommend caution. Use it as enablers. Do not think this is going to be the new way of delivering healthcare. It is just an enabler. And there are these myths floating around. I call them myths. People think that, you know, the retail industry or Amazon and Flipkart is the way goods are sold. Do you know only 15.2% of the sales in the whole United States of America is online? 85% is still brick and mortar. I had a debate with colleagues of mine about this whole aspect of education. We're coming to this. And I said, what happened in education? There was a revolution. You have online platforms. You have everything which is taught in Harvard and IHMR and Stanford on the web. Everyone can access it. But why do you still have a stampede of students who want to go to brick and mortar colleges and listen to faculty? Why do you need to listen to faculty? Watch the videos, see the online programs, and you're done. Brick and mortar universities still exist. You come to listen to faculty here. Why? Everything could be online. But it's not the case. And particularly in healthcare, it is not a commodity. You want to interact with the person who is delivering care. You are looking for empathy and sympathy. You are looking for someone who wants to listen to you. I was talking yesterday. How would you feel if you had an acute pain in the abdomen and you were put onto an interactive voice response system, or somebody gave you a mobile app and said, this is the answer to everything? Not one in this room would do that. You will seek out a physician. This is exactly what is happening in our tier 3 cities and villages. They still seek out a human being in healthcare. You can put any apps out there. We are trying to bridge this with Ashas. Obviously, we cannot get doctors over there. Yes, you have a system which allows quacks to flourish, but we are looking at reform in education, and we genuinely believe that you need tier 2 or tier 3 care providers who can take care of these areas. So please understand, technology is an enabler, but it is not the answer. There is this huge wave, almost a mob mentality, that this is the universal solution to everything. It is not. And we must not encourage that beyond the point. We as managers are responsible, as leaders are responsible to accept or embrace change in moderation. One has to think. One has to decide what is going to work for you. Big data, analytics, people are talking about predictive analytics. People are saying that predictive analytics is going to decide everything. Even now you have algorithms and care pathways. You could just put up posters in your entire hospital with flowcharts and algorithms and say, anyone and everyone can deliver this care. Is it possible? It is not. So we need to really think about these things and understand what they can contribute, but more importantly, what they cannot contribute to sustainable care delivery. And I hope that some of these aspects we discuss in greater detail. I'm chairing the session on managing disruptive change, but there are equally interesting sessions on data analytics, mobility, artificial intelligence. The founder of artificial intelligence, champion, Elon Musk, has also just recently said that I believe this is going too far. People have started pegging everything on this latest, shall we say, fad. One has to understand as managers and leaders what to pick and choose from the sea of technological innovation and scientific advances which are coming. One has to be discreet. One has to know what we want to pick up. We should not buy what is sold to us. We need to buy what we need. We cannot buy everything which is on the market. There will be enough people who will be pushing these technologies, but we have to use our wisdom. We have to rationalize, why do we want these things to come? Will it make a difference? Will it improve something? So these are various thoughts which run through my mind when you talk about imagination, sustainable health systems. It's going to be an interesting 2 days, but these are some of my thoughts about it and in which direction we should be heading. I thank Dr. Gupta and the team at IHMR for giving me an opportunity to interact primarily with you, the students. Of course, we will debate also, and I hope this is fruitful, that you take away some meaningful learnings. And again, I'm saying, as a chief executive or whatever you would like to call it, the trick, the essence is execution. Anyone can dream with their eyes closed. It doesn't require a PhD. We want people who can dream with their eyes open, who can walk the talk and execute and deliver. We have myriads of reports, the World Economic Forum, McKinsey, you name it, there are hundreds of reports. How many have actually translated into execution and making a difference? And the singular reason is we do not focus on execution. As managers, you should. That is your role. I was talking to them, you have to be proactive managers. You cannot be reactive managers. Reactive management is no management. You don't need trained managers for that. You want thinkers, you want people who can imagine, people who come up with ideas, but most importantly, who deliver on the ground. We come from an ecosystem where failure is not an option. You have to deliver. So even you have to wake up and grow in this ecosystem where you have to do your best and you have to execute. If you cannot execute, then your role of a manager is null and void. So please take home this message. I wish you all the best for the conference. I will be spending the whole day here with you. Thank you very much.